Welcome to another edition of Journey of Hope. Stories of people that have been impacted by the healing ministry of Loma University Medical Center. People who have experienced a medical crisis or a trauma, an illness, cancer, and have not only overcome, they've not only survived, but they've gone on to be thrivers, not just merely survivors. Our special guest today is Dr. Mark Reeves, Director of the Cancer Center here at Loma Medical Center. I'm Lynn Martell, and I'm also with Loma Medical Center. And Dr. Reeves, it's good to have you here on Journey of Hope. We've got people from around the world that are watching this program. Most of our interviews have been with patients that have been impacted. But I thought it would be good to talk to somebody that is an integral part of helping them on their journey of hope. And there are so many people that are being diagnosed with cancer. In fact, many of our former people that we've interviewed have been cancer patients of one type or another. But before we get into the discussion here about what the Cancer Center is all about, tell us about yourself. I know that you're from Loma Linda. Your family's been around here. I know you were born in Los Angeles. You went to the medical school here. Tell us, you went to medical school and then what happened?
Sure. So, Lynn, I appreciate you having me here because cancer is something that means so much to me. And so these people that you've talked about who've overcome this is something that I see every day, and it really has a huge impact on us as providers too. I went to medical school here at Loma Linda, as you said, and I got interested in the field of oncology. I trained at UCLA in molecular oncology and graduate school. And then I did fellowships twice, actually, one at the National Cancer Institute and then another
That's back in Maryland?
In Bethesda, Maryland, yes. And then another in New York City at Memorial Sloan Kettering Cancer Center. And those things really focused my view of life and what is important. And it was through those experiences that I saw how much cancer has an impact on people. When I first started, I thought this is something that is going to be very difficult for me to be in because it's a field of suffering. And as I have been in the field, I have been amazed by the ability of patients with cancer to, as you put it, to overcome, and not just that, to thrive. And so it's really something that motivates and inspires me as a person who takes care of patients with cancer every day.
Well, I've noticed, and as you know, I've had a couple of kinds of cancer myself.
Yes.
You were instrumental in
Yes.
surgery of one of the cancers I had. But cancer is not just an individual disease, but I've discovered that if it's a particular kind of cancer, it may be a couple's disease, or if anybody has cancer, it's the family. The whole family is involved. And I think that's a part of what this Cancer Center is about. And we haven't always we've always been treating cancer for many, many years, but the Cancer Center is something new.
Yeah.
And tell us about it. What is a Cancer Center?
Sure. So as you said, Lynn, it's seldom that a patient has cancer and it affects only them. It's something that affects them, certainly, and they need treatment for it, but it affects their family, it affects their loved ones, it affects their friends. A cancer center is a place where the treatment, research, prevention, education about cancer is all brought into a single place. And it's one where all of these parts of things are all put together into a single thing that addresses the entire person. So certainly the treatment part is a very important part of things. It's very complicated for many types of cancer care. And what the Cancer Center does is it puts all of those services, treatments with different doctors all into the same building.
In other words, prior to when we had the Cancer Center, somebody may have to go to one building or one part of the hospital and see many different people, and now we're trying to bring them together into one area.
Yes, that's right. So not just different parts of the hospital. As you know, here at Loma Linda, the providers for cancer have been spread out across many different, not just the hospital, but different buildings. And so patients might need to see a a surgical oncologist in one building, a medical oncologist somewhere else, a radiation oncologist somewhere else. All of those being very important to their treatment, but very difficult for the patient to navigate through this type of a complex care. There are a lot of types of diseases that have only one type of treatment that's necessary, but that's very seldom true in cancer. And so cancer, by its definition, is a very complicated process. And we know that we can actually make that much better for the patient if it's all together in a single place with a single group of people taking care of that patient.
Well, there's so much trauma anyway to be diagnosed with cancer and then try to begin to navigate. And oftentimes there's not the best of communication between all these different entities that are out there, which makes it all the more frustrating. I think we have a slide here that will speak to part of what you're talking about here. Maybe you can see the slide there.
Yeah.
Why a cancer center, and then it's talking about the different aspects. Go ahead and comment on that.
Sure. So as we bring all of the treatment, research, education, prevention together into one place, it allows us to really build a cycle where we ask a clinical question, we send that to the research lab, we translate that from research lab to bedside, and that then becomes more effective cancer care. And then that just continues on with the same cycle being repeated over and over again. The reason that doesn't happen very well outside of a cancer center is because it is in that center where you have researchers and people interested in that specific type of cancer in the same place. They see each other every day. They talk to each other. You referenced
Right.
poor communication and integration together. When you're sitting together in the same place with people that care about cancer, you're going to talk about it. You're going to more effectively integrate that care. And that's exactly what happens, actually.
So you're building a team, really, then,
That's
what
it.
you're doing. You're talking about a team of people that will treat cancer patients. And I suppose that is a distinct advantage of being in a health science center, where you have all these different components of the education. You've got the research that's going on.
That's correct. And as you said before, we have had the components of this in the past, but unfortunately they haven't been integrated well together. And so although we have the parts that lead to good cancer care, it's been very difficult for the patient. And so what we're trying to do by having this center for patients with cancer, a cancer center, we're trying to overcome that complexity to make it actually a patient-friendly experience. It's actually been shown that if you do it this way, patients actually get through their treatment better, and they actually have better survival.
Better healing because
Yeah.
of the, again, we're talking about the whole person approach and being able to integrate all of these different disciplines together. Let's take a look. We have another slide here that I
Okay.
wanted to bring up, and you can talk about the
Sure.
different centers there.
So what we've done is we have, in the Cancer Center, we have divided it into what we call 11 centers of excellence. And so as
All in the one center.
that's correct. Now, we have not implemented all of those centers yet. As we'll talk about, I'm sure, in a minute. We've really only built the first phase of that. But our goal when we're finished with this is that we'll have centers that treat all of the major types of cancer. And so you can see a breast center, a GI center, a GU, genitourinary center, a gynecological center, a head and neck center, a hematology bone marrow center, neurological, pediatrics, skin and melanoma, soft tissue, skeletal, and thoracic. And if you add up the components of this, with each of these centers having people that are dedicated to that one type of cancer, it makes it a possibility to actually deliver not only world-class care, but be able to do it in a way that makes it easy for patients. And so then essentially what we will do then is to build a center around each of these types of cancer, so that patients with any of these types
So you'll
of
actually
cancer,
have several different centers then within the cancer center,
that's correct, with
Okay.
people that are dedicated to that type of cancer.
which makes all the difference in the world when a patient has the cancer. They're under stress and worried about a number of different things, and the more, I'm sure, the more you can do to make the patient relax and just, be part of the healing process, it makes all the difference in the world. So tell us what some of your plans are.
Okay. So as we have the Cancer Center, we've opened the first phase of that. It'll actually be built over the next couple of years in 4 phases.
And we're in stage 1 now, or
That's
phase
right.
1?
We have finished phase 1. Phase 1 is a build out that included new clinic space for the medical oncologists, which actually participate in all of those 11 centers that we saw. And in addition to that, an infusion center. What we did when we built this is that we actually asked cancer patients, how should we do this well? And
You got input from the patient then?
Yes, and it's a good thing we did, because as we had started out in the process of making plans, we thought we had it right. We asked patients in quote-unquote focus groups, and they told us we didn't. And so we made some changes addressing the exact things that you brought up. So making it a place where patients feel relaxed, making it a place where they feel comfortable, almost like a home, if you will.
Mm-hmm.
Nobody wants to have cancer.
Kind of more of a warm feeling than a cold, sterile environment.
That's right. And then after we opened the center, we've gone back to patients and said, have we done that well? And over, we're getting from patients that, yes, it does feel like a place that's comfortable and relaxed, and it's a place where we actually can heal.
So the feedback that you got from the patients kind of gave you some guidance and direction and kind of changed some of your planning.
Yes.
And we're still talking about the first phase now.
That's
You've
correct.
completed the first phase, so what are your plans?
Sure. So in the second, third, and fourth phases, we'll be implementing such things as we have what is called a symptom management clinic, where patients who are getting treatment for cancer will often have bumps in the road. They will get sick along the way. Right now at Loma Linda, we don't have a great way for those to be taken care of other than to just end up in the emergency room.
If they're sick in between treatments or something, you mean, and where do they go and who do they contact? And
that's
again,
right.
the frustration and the stress level goes up.
That's right. And so often those patients end up needing to go to the emergency room, which to me is the last place you want a patient who could be treated outside of there, but they're sick from their cancer. And so our symptom management clinic, we've actually already opened it in phase 1. We got so excited about it that we couldn't wait. But the phase 2 will give us an actual physical location in the same space. And that'll actually eventually, when we get finished with this, it'll be open 24/7. This will be a ways down the road, but it will allow us to treat patients by people who they know. They've already established with these providers, nurses.
That contributes itself to the healing process.
It does.
I'm sure that it does.
It absolutely does. In other phases, we will be, just this next year, in July or so, we will be opening an inpatient part of the cancer center, so a dedicated medical oncology unit up on the 9th floor of the hospital. It's something that we used to have. Over the last several years that fell by the wayside, but we have, as part of our new focus on cancer, we have reestablished that service, and that's an important part of being able to take care of the entire need for patients with cancer. One of the things that I'm most excited about is that we have a part of the Cancer Center phasing that will actually build out the space between where right now medical oncology is and the radiation oncology. So being able to incorporate all of these specialties into a single physical space within the hospital.
So they're all going to be in the same general area there, which is going to be, that'll be wonderful.
And the last phase of this will be a clinic that actually allows the final implementation of these centers of excellence. And that is bringing all of the subspecialists, so surgeons who treat GI or GU or gynecological cancers, into the same location with the medical oncologist, the radiation oncologist, together with the rest of the support services. So dietitians, social workers, what we call navigators. So these are nurses or other paramedical professionals who actually lead and guide patients through the treatment process, all together in one place. That's something that we will be able to fully implement when we have all of the last phases built.
So will each patient, each cancer patient, will they have their own navigator?
Yes. So when they come into the Cancer Center, and at that time they'll be coming through a single portal, if you will. If you have cancer, it won't be any more problem of who do I call or do I get a hold of this doctor, this doctor. Call a single telephone number. We've already designated it's 800-78-CANCER. There will be a group of people specifically trained on how do I direct patients to the specific area that they need to be in. And part of that process then is, yes, the assignment of a navigator who will be overseeing their care throughout their entire process. And then that will span across if they need to have, let's say, chemotherapy at this time, to radiation therapy, to surgery, or many other types of treatments that they may need. That navigator will actually be with them through the entire process.
And all the way through. I'm sure we have some people that are in here for just a couple, patients for a couple of weeks, and their problems taken care of. Others are for months, and some you probably have for years.
Yes, we do.
They continue on, and if they're getting somebody different every time they come back, it can be a very, very frustrating experience. We had a previous slide on there, and I'm not sure we were able to talk to part of what was on there. Was that about the navigation there?
Well, what that does is, I think that slide shows us all of the infrastructure that we have built and are building into the cancer center.
And we're talking about a separate place now over there at the medical center.
That's correct.
We got a picture of it we'll look at later on.
Yeah.
But it's an actual physical location. So the slide is demonstrating what?
So what this does is it shows the actual, as you said, there is a building. It's actually just to the right, if you will, of the front of the medical center when you come in. And in addition, there's another building just to the side of that. It is immediately parallel that together, called Schumann Pavilion, Chan Shun Pavilion, make up the cancer center. What this slide shows is the support services. So the patient navigators, the nurse practitioners, the clinical services such as, let's say, pathology, coming actually there to the patient instead of, let's say a patient needs to have their blood drawn when they come in to get chemotherapy. We don't send them out to have that done anymore.
To
we
a
do
separate lab. It's
That's
done
right
there.
We do it right there in that location. And so we've built all of this infrastructure and together with all of the physicians for that into a single place that has these centers of excellence.
So are you bringing new people in, or are you incorporating the people that are here? Or
That's a great question. We're incorporating much of the excellence that's already here, but we are absolutely bringing new people in. So some of these programs are new programs that we don't currently have people filling those positions. So our patient navigators, we've had one or two in the past. We're actively hiring more. I can speak just to the infusion center, for instance. We have doubled and almost tripled the staff, and that's been a very good thing, but it's a hard thing to find all of the well-trained people in oncology that you need to run a center like that. We have anticipated those needs, and we've looked far into the future to find the staffing for that. But we are bringing in absolutely new people. But there are many professionals that are here that are already very good at what they do, and they are being incorporated into
kind
the
of
center.
assimilating them into the overall process. I think we got another couple of slides we'll take a look at, and you can speak to that, and then we'll continue on.
Mm-hmm. So this is a slide that shows the kind of the outside, if you will, of the new cancer center. Again, the later
there's a new physical. I mean, the building's always
the
been
building's
there,
been there.
But
What happened actually? So in the about a year or so ago, there was an actual complete tear out of the A level of Schumann Pavilion. So it used to be filled with things like conference rooms and office spaces, and now if you go down there, it really is a world-class clinic and infusion center. It's interesting, we've had actually the architect who helped us design and build that has been nominated for awards for this actual space.
Really?
Nationally, and so it's something we're very proud of. The upper floors of that same pavilion then in the later phases will also become
so you're talking about on the other floors? I didn't realize that.
Yes, yeah, that's correct.
Oh, I think a couple of other slides will show us, if we can take a look at them right now,
yeah, so these are slides that show some of the interior of the phase 1 of the cancer center. This is the place where patients would come into. And again, it's a way where we actually designed it so that it would be easy for patients to get to various places or another. So for instance, in this slide here, it actually shows the clinic space off to the right, the infusion center immediately to the left, and there's actually a hidden lab space that is right there so that it's all in the same place as patients come in. It makes for fast patient flow and able to get quickly through to places that you need your service from. This is a picture of the waiting area. You have to have a fish tank to make people feel relaxed.
But it's a very warm and inviting.
It is.
It really is.
I think it is.
And kind of a relaxing. And I've been in there and I've noticed when the patients come in and they sit down and they're waiting to see their doctor, but it's a far different atmosphere than
what we used to and what we used to have, frankly.
Yeah.
We used to have a space that was not very conducive to healing. This is one of the areas in our one of the chairs in our infusion area. Just a couple of points I'd like to make. Each one of the bays has a separate flat screen TV and player. Patients, when they have infusion, are stuck there for a while, and we need to give them something to do that's useful. Additionally, the ceiling that you see over the top of it, it looks a little bit funny. That's actually a radiant warmer because patients, as they get infusion of different types of treatment, they will get cold from that. And what this allows us to do then is to have the patient heated to whatever temperature feels good to them, but not heat up the rest of the room. And they work very well.
Really?
Yes.
Oh, that's a marvelous thing for a patient that's, they're undergoing this infusion and the discomfort of that, and they're going to be there for, sometimes they're there for a couple of hours, aren't they?
Sometimes for even longer. If they have several treatments that they need, they can be for up to 6 hours.
In one place, and of course this really helps them there.
Yes.
So how is the Cancer Center being accepted by others there?
Well, I think that, we have had really just an amazing outpouring, if you will, by people who've said, this has really been a long time in coming. And I think it is gratifying in a sense, but I know as a practitioner, as someone who takes care of patients with cancer, maybe I have a bias, I'll admit, but I think that patients like this really deserve this kind of care because there are so many problems that they already have in their life because of just the illness. But again, I want to remind you, and you know this, Lynn, better than anyone because you've been through this. Those patients, don't start feeling sorry for them because they are ones that actually have the most amazing spirit of anyone. But this is a center that has been a long time in coming and very, very needed here in the Inland Empire. There really isn't any other multidisciplinary cancer center that integrates all of the aspects that we've talked about here: radiation, infusion, surgery, research, prevention, all into a single place. There are places like that, obviously, in larger cities, but here in the Inland Empire, we haven't had that until now.
So you and your team are moving towards a world-class cancer center.
Yes, that's right. We're not there yet. We have implemented parts of it that are absolutely world-class. When we get finished with all of the phases of that, that's exactly correct.
So that people will be able to come not only from the Inland Empire, but around the state and even around the country.
Absolutely.
I mean, we have people, as you know, coming in from around the world for different types of treatment here at the medical center. But as this dream continues to be fulfilled, it's going to be making an impact in a wonderful way. Well, as you know, Loma Linda has an undergirding philosophy to make man whole.
Yes.
Mentally, physically, spiritually, and emotionally. And this Cancer Institute and the dream, the Cancer Center and the dream that you have and bringing these different components together is going to contribute greatly to their journey. When people are diagnosed with cancer, the big C, it's a frightening, terrible, traumatic experience. And, it's all of a sudden they think they have a death sentence. And I'm sure part of your role and the people that are working with you help people to realize that, hey, they've been diagnosed with cancer. And there are options, and you're going to provide them with a menu of options and help them on their journey of hope. What do you see taking place here in this next year?
So in the next year, we have a very specific set of phases that we will be building out. As I said, we'll be opening the inpatient service. We'll be building out the spaces that will house the symptom management clinic. And then over the next 1.5 to 2 years will be the finishing of the phases that will allow us to put the rest of the subspecialties into that single space.
Well, that is very, very exciting because it's been a long time in coming.
Yes, it has.
And you begin to pull people around you that will help support the dream that you have. We got just a couple of minutes left. Why don't you just share with us what you dream for here in the next 2 or 3 years?
Right. So really, my dream for the Cancer Center here at Loma Linda is, as you already said, to make it not only a world-class place where people can come to receive multidisciplinary care, but to do it in a way that makes it easy for patients to receive that, to center their care around them rather than in the past, as we've all too often done, centering care around ourselves as providers. And so making this both a place that is world-class, but also make it patient-centered, patient-friendly. If we can accomplish that, and I'm pretty sure we can, then I think we will have done well for patients with cancer.
Well, you're well on the road, and I've encountered and talked to many of the patients and several of them that have been going through the center there, and they're just extremely pleased. I mean, some of them that have been here over a period of time here in the Loma Linda area have noticed the marked difference that has taken place. Again, you know, Loma Linda has a mission to make man whole. We have people coming from around the world, and people talk about the magic of Loma Linda and something very special. Again, the Journey of Hope is a program where we interview some of these people that have been impacted by the healing and teaching ministry at Loma Linda, and it's people like you and the other people there that are bringing it to life and putting legs on it. And Journey of Hope is this story of people that are in the journey, and you're sharing with the audience here how that journey is going to be greatly enhanced by the Cancer Center. Again, I want to thank you for being with us. I'm Lynn Martell with Loma Linda Medical Center.